So I had the privilege of working with the Autism Friendly Health System Initiative at Rady Children's Hospital for my community placement. And so for my project, I did some initial program evaluation of the initiative within the emergency department. Next slide. Okay, so as a little bit of background, we know that children with autism use healthcare services more often than neurotypical peers, and this includes the emergency department. And nobody likes going to the hospital. If you're going to the hospital, it means you're not feeling well, and hospital settings are often chaotic and stressful, and this is especially true for children with autism and their families. So the Autism Friendly Initiative at Rady Children's aims to implement some specific practices with the goal of improving healthcare encounters for patients with autism and their families, as well as the providers who are trying to care for these children. Next slide. Okay, so there's a lot of parts to this initiative. I'm just going to give a very brief overview as well as a timeline. So the initiative initially rolled out in 2019 when the Autism Friendly questionnaire was implemented into MyChart and Epic. Epic is the electronic medical record system where the patient's chart is held. The Autism Friendly questionnaire is filled out by caregivers, and it collects information about the child and specific information that might be characteristic of an individual with autism. So for example, differences in communication, sensory sensitivities that might cause agitation or anxiety, specific behaviors the child might have, as well as behavioral strategies that could be useful with the child. So the idea is that providers are able to view the results of this questionnaire in the patient chart in Epic, and then use that information during the patient visit. So then in January 2020, providers in the emergency department began training on how to use the AFQ as well as a complementary autism-friendly toolkit. There's an example of that here kind of on the right. So the toolkit includes a lot of really practical resources that are commonly useful or helpful for children with autism. So for example, some fidget toys, different items that might help with sensory sensitivities, visual schedules. So kind of on the far right, you can see kind of a visual schedule or a social story of a medical procedure. So within the ED, there's this toolkit then that the providers could use to help support the patient during the visit. I also want to add that starting in around January 2020, the Autism Friendly team has also had a presence in the ED. So the amazing Abby High, who is a BCBA, has been working in the ED alongside providers for the past couple of years, part-time, in order to help provide some behavioral support, as well as to model to providers how to use the AFQ and how to use different items in the Autism Friendly toolkit. Next slide. Okay, so since the time of initial training, providers in the ED have been invited to complete a survey for ongoing program evaluation to assess their perspectives of the initiative. And so what we did is we looked at the results from that survey and compared results from surveys completed in 2020 to survey responses from 2021 to look at the differences between year 1 and year 2. And we specifically looked at 5 items from that survey that touched on the themes of adoption and acceptability of the AFQ in particular. Next slide, please. Okay, so I want to orient you to what you're seeing. So these are different graphs for each of the 5 items that we looked at. There's a light blue bar that indicates year 1. A darker blue bar on the right side of each panel indicates year 2. And so what these first three panels are showing is that compared to year one, there was a greater proportion of providers in year two who said that they had heard of the AFQ, they knew where to find the AFQ in EPIC, and that they had used the AFQ. Next slide. Okay, so similarly, in year two compared to year one, providers gave higher ratings of the AFQ as being helpful during their interactions with patients with autism. And year two providers also said that the emergency department was more autism friendly in year two compared to year one. Next slide. All right, so these are, I think, some pretty exciting results. They suggest an increase in adoption and acceptability of the AFQ specifically, but since the AFQ is such a core component of the initiative, suggests some initial adoption and acceptability of the initiative in the ED more broadly. One thing that I like to point out is that this initiative rolled out in January 2020, and as we all know, a few months later, the world was hit with COVID. We all know about the strain that put on the healthcare system and emergency departments in particular. We've all heard about healthcare worker burnout and staff turnover. And I know for a fact there's a lot of traveling nurses in the emergency department at Rady. So the fact that we're seeing kind of this greater or indices of greater adoption and acceptability in year two compared to year one is pretty awesome given the strain of COVID. So of course, let's keep it up. I think that these results provide support for continuing to implement the autism-friendly health system initiative across Rady Children's and other departments, and there's ongoing effort to do that currently. And then there's, of course, a lot of future work that's needed, future work that could address some of the limitations of this study. So I was using, some program evaluation data, and there's some limitations to the data in this kind of study that could be addressed with future work. But then ultimately, the goal of this kind of work is to improve care for children with autism and their families when they come into the hospital. And so future work is really needed to examine family experiences to get a better sense of how this initiative is impacting families. Next slide. All right, so I want to thank a lot of people. So Dr. Brookman-Frazee, Dr. Carr, and Dr. Stadnick, who were my committee members, Kristen Gist, Abby High. Abby was my on-the-ground mentor. I already mentioned her. She's been a point person for this initiative in the emergency department. And then the rest of the autism-friendly team. And of course, a big thanks to the whole San Diego Len community for your support this year. And that's it. Thank you.